Hey guys, it's Dr. Emer, and we are doing now our Instalift procedure. This is what we call the mega lift, when you do literally the full face and neck. And we are doing high vector internal threading with cone threads. You guys can see here, these are little baby cones on a suture. And we're putting those inside the skin. Hold on. Good. To get lift. And this is going to embed in the skin to give us not only lift, but also collagen production. So the quality of her skin is going to look better, and the lifting of her skin is going to be better. And we're doing, in this case, we're doing our our non-PDO threads, which are made of PLGA, which is a sugar-based thread that dissolves into the skin over up to 2 years. The cool thing about that is it creates a scaffold under the skin because of the cones that is enough to even improve the texture of the skin and the quality of the skin. And when we do a mega lift, we are literally putting in more stitches than you do even sometimes a facelift. Need the needle really quick. That you do even with the facelift. So we are really lifting. Just have to make sure the vector is perfect. Hold this a second. There we go. Beautiful. Everything is going well. How does it feel? Is it hurting?
I don't feel anything at all. I feel like something's in my ear.
Well, there is a little thread. It's a little whisker. A little whisker is in there. And it's basically tightening because I go all the way up to the ear area.
Yes.
So we're literally going down. Jordan, what's your favorite thing about the mega lift? You love this result. You talk about it all the time.
They're tight, tight, tight.
That's what we want. And you know what's great? The candidates that are best, that have just a little bit of looseness, already have a nice bone structure. If you have a lot of looseness, you're not going to get the same results. You're not going to get even great results. Did you have filler back here too?
Not that I know of.
In the jawline? Okay, I was just curious.
Yes,
you did?
my jaw. Yes.
Because I feel it. Yeah, I feel it.
Yeah, it's lumpy potatoes.
Exactly.
Sorry, don't.
But it's okay. We're tightening. So this is a good point. We were talking about previously having fillers. Look at that. It's already awesome. And we can feel her filler. So I don't know if she developed scar tissue or if they did it improper, but regardless, we are now going to tighten around it. And it takes a different level of understanding of these threads to be able to do that. So I'm glad that she came to me. That's number one. And number two, I'm glad we chose Instalift because this is a really good thread for that situation. You can break through those lumpy bumpies and tighten everything and make it more even, which is great. So you guys can see, again, those little cones. Get the needle. So sometimes you get a little dimpling. What we try and do is just soften a little bit. Now that means that the skin needs more tightening in that region. So it can happen and it goes away. You just gotta be patient. Some people get really nervous about it, but you don't need to. So we are mega lifting. We're almost done on this side. Jordan, what do the patients say about the results of this? Because you follow.
I follow the patients.
Our clients.
They love it.
What do they say about it? What do they love?
They love the tightness, the jawline. We had some great patients writing. They love how tight their jawline is. We had one lady we just did around her mouth. All the wrinkles around the edge of her mouth were all gone.
It's true. She did love that. So, in this one, we're going to go really tight and high. Look at that. So we can really pull. Look at that. So see the definition on the jaw? That's what we're going for. Getting that jawline sculpted. We're doing a unique approach to the lift. We're cross-hatching the sutures on the neck to create basically a corset on the neck. We want it to get super tight. That's the goal.
What about the pain level? They want to know about that.
0.
Superwoman here. No, the numbing hurts a little, and then
It
after
just
that,
stings, yeah.
After that's done,
I don't feel anything.
she feels 0.
Maybe a pinch here and there.
feel free. You can punch Jordan if there's any pain.
Your
I
face.
hope
Not
you're
me.
fine.
Thank you.
Sarah, I hope you're
Let me
watching.
focus. Exactly. Sarah, we're going to say hi to you. Sarah, you're next.
Sarah with Scavenge.
Sarah is
She
next.
says she obsesses over you.
Really?
She watches
Oh,
your
I love her
She
already.
watches your YouTube channel. She's the
Look at-
nurse.
Look at this.
Yeah.
Look, that jawline's going to be sick.
Mhm.
It's going to be so good.
No jowls, right?
How long does this
No.
last?
This will last about 2 years, you guys. Do a little more. This will last
So
about
Allison, Melissa Ganas loves you.
Oh, Melissa.
Yes, Melissa, you're next too.
Mm-hmm.
Turn right a little bit more. There you go. So again, in this area here, this is
long
what I
is
was
this
just
gonna
going to say.
last?
You got to be a little more careful because there's some veins,
I'm
which is
veiny.
fine. It's okay. Just got to be a little more cautious and a little more pressure, as you don't want it to bleed too much. But it's okay.
I love your work, Dr. Emer. Always so ahead of your time and innovative.
Thank you guys.
Who
You
is
know,
that? Sarah?
when
This is someone else, not Sarah.
when I was in my training, everyone used to say no one would want that, or
How long does it
That's
take
not
to
gonna be
heal and see
good.
results?
I always tell people about a couple weeks to really start to see it, but about 6 weeks is when people really notice it.
People are saying how busy you are because you're working Saturdays. Not a lot of doctors do.
No, we love what we do, guys. So we are here, and Rosa too. Take a look.
Rosa.
Hi.
Rosa is one of our long-term medical assistants. She is here with me, all the way from LA, helping me out because we love our patients so much.
A better way of a facelift? Question mark.
No, it's different. Not a better. It's different. I mean, look at this, guys. Look at
Depends
this.
on the candidate.
Look at this already. I mean, this is sick. Look at this. The tightness that she's gonna get. It's gonna be phenomenal. So one side's done. Mega lift on the left is done. She did great tightening here. Look, I also pull up the platysma and do a special technique. Looks amazing. So let's go to this side. We're gonna do the same thing here. When done right, it looks phenomenal. When done poorly, there can be problems.
Only go to him.
Only go to me. Thank you. Appreciate it. But you know what? A patient of mine yesterday, she said to me one of the biggest reasons she came was that she went to a bunch of other doctors here in New York. None of them, of course, worked on the weekends, like you were saying, Jordan, but they also didn't ask her about her personal life. They didn't care to know about why she was wanting to get treatments done. I was asking her tons of questions about her MBA, her parents, where she's from. I want to know my patients. Like, that's important to develop a relationship with the person that's taking care of you. You know? So I think that's something to consider. Just like you guys go to your hairstylist or your dentist and they know you, your makeup artist, your nail person. You want people that want to make you look your best and understand.
You wanna know what brand of thread we're using?
We just said
There's
Instalift.
Instalift silhouette threads.
So I know what she wants. I know what we're looking for. Yeah, I definitely feel the
Yes.
filler here.
I'm sorry.
It's okay. It's not your fault. But we're actually, this will help break through it a little bit. Get that a little bit right there. So we're gonna go high and tight in this one. Go a little higher on this thread over on this side. She's a
Neo
little.
White saying hi to you.
Hey Neo, make sure you're following our skincare protocols. Make a good tags. There we go. Perfect. I can't wait till she gets the results of this. So good.
Well, asking, do you prefer mint threads as well?
Yeah, I like mint. We've been using a lot of mint for our cat eye look and for our securing of other threads.
Speaking of,
It's a different thread, what were you saying?
how's my eyebrows look?
Yeah. We were talking about this the other day. PDOs are great in some capacity, especially on the eyebrows, but they don't last as long. So you have to use different threads. I tend to go towards the Miracle or PDOs. I like them. I think they're a lot thicker and have a lot more security. Beautiful. There you
You're
go.
asking where we located, guys. Right now we're in New York, as you can see, or Manhattan. And guys, we are based in West Hollywood, California. We also go to South Florida as well in Boca Raton. If you're interested in any one of those, guys, send us a DM, fully email, phone number. Neo said he's following a skincare regimen.
Beautiful, Neo. Follow that regimen. so we can transform your skin. And for those that are doing anything around the eye for eye tightening, one of my favorite products right now for that area, besides my Emerald Skin Refit Eye, sorry honey, there's a little scar tissue here, is the Upneek product. And it's doctor dispensed only, so you can get it on our website, but it will help tighten and lift the eye area. And you should definitely consider using it because it's going to give you an enhanced outcome.
People are saying, "Hi, Dr. Jason, you get a bunch of hard eyes."
Hey guys.
Which what?
Hard eyes. Hey. So now we're going to do final on the jowl. This is the area all the women hate. Let's get those jowls. You know.
She was like, in her testimony, she's like, "I'm feeling jolly. Not jolly, but jolly."
Not jolly, not jolly, not jolly. We want jolly, not jolly. Or both. All right. So we're getting that. So I'm going to go on this one all the way down to parotid fascia. We're going to go deep here because I want to secure it on the jawline. I really want to pull not only the jowls, but I want the definition of the angle. So look, see? That's a technique, a trick. Go ahead. Perfect. Beautiful. Last few. Let this down just a little bit. Keep your chin up for me. Good.
Ashley on here right now, our surgical sales.
Ashley, if you guys want to make any surgical coordination, Ashley's your girl. Contact us for surgery, and Ashley will take care of
You
you.
want to know, is she feeling this?
No.
She knows it's happening. She doesn't feel it.
No. I could take a nap.
She could sleep right now. She's gonna do. It's gonna be phenomenal.
Come in, take a nap, wake up snatched.
Yes.
Oh my God! Nap and snatch.
Oh my
Snatch
God.
and nap.
Snatch and nap.
Snatch and nap.
New service.
That would be great. You snatch, and then you get to take a nap in the hyperbaric with a massage by Robert, right? Our massage therapist. People love Robert. Rosa had her first massage from Robert. How was it,
It was
Rosa?
amazing.
Deep
So good.
tissue.
Deep tissue, got every part that we could get. Oh, it was the best.
Well
Trust me,
deserved.
what type of procedure? I'm
Thank you.
assuming it helps you stay younger and keep wrinkles away.
Yes, it does. You have to hold up here.
Yep.
Hold on. Okay. Let's do a little bit right there.
Since you're the best in your work.
Thank you. We're doing a special technique here I've never seen anyone do. This is called a corset on the neck. We're overlapping and going deep with the
Dr.
threads.
Emer has a great office personnel. Called last week. She was so sweet.
Oh, who was it? Thank you.
Let
We
us know
gotta
who
let
you
them
talked
know. Write a review. We would love that, actually.
We'd like
Yeah.
to know who you talked
The
to.
personnel would be really happy to hear that, I'm sure. Hold on, let me see. Need the needle. Neck is very thin, so you have to be really conscious. Hold on.
Offices on here.
What?
A bunch of our offices on here.
Good.
Teresa.
Rosa, say hi. There we go.
Hey,
Look at that, guys. Here we go.
everybody.
We did it. Right at the angle. Look at that beauty. One more to go. Bleeding is normal during this procedure. I know you guys are probably freaking out.
Don't freak out.
Don't
I'm
freak
fine.
out. She's
Someone
fine.
said,
I'm
I mean,
fine.
she's gonna live forever after this, right?
I'm a vampire now.
Have you guys ever seen what was that? What was that movie where they drink the potion and then they don't die? In the 80s. Oh my God.
Cocoon? Cocoon?
No, that was a good movie too. No, the movie with
Teresa
the two
might know.
girls.
Teresa's on here, see if she
They
knows.
drink the
Teresa knows
eternal
movies.
drink and then, but they fall apart and they keep using spray cans, spray paint to repaint themselves.
You have a Hey Guys from Greece.
Oh my God, you guys have to see it.
Aw.
It's like what? It's with I keep saying Bette Midler, but it's not. I can't remember now. Teresa will know. Teresa will
She
know.
knows all the movies.
Yeah, her
So
and
Death
I.
Becomes Her.
Death Becomes
Oh
Her.
my God.
Yes, that's what we need. So Death Becomes Her is my refit face. That was my origins of my refit face product. Yeah, exactly. Who said that?
That was Teresa.
Oh, Teresa, I knew it.
We have a hi from New York City, guys. If you're in New York City, come see us.
She knew it was Death Becomes Her. I knew it. See, Teresa always.
What kind of suture do you use, guys? These are our Instalift threads. We're doing our Mega Lift. This is a full face of threads, including jaw and neck.
Mm-hmm.
So these
This is
threads
what
are
it's called
so
again.
tight.
This is our mega lift.
These threads are so tight, I have to place the central cone sometimes a little bit more to get it in there a little more. It's a little bit harder. Hold this a second. Let me see if I can pull it through. Sometimes that last one's the hardest one. Again. Of course, right at the end.
Of course.
Yeah.
The one little one I can't get. Hold on. Just give me the scissor and we're good.
Okay.
Is it secure now?
I don't know.
No, I just need to do this. Okay, beautiful. All right, we're secure. So now we're gonna lock the threads in place. So you guys can see, look, I'm locking, we call this securing the cones. So she's gonna feel this a little bit because I'm gonna pull really tight.
Not really.
Oh, good. Beautiful.
Doesn't feel it.
She's a beast. She's a beast. She knows what she's doing.
Someone wants to come see us in New York, guys. Send us a DM, full name, email, phone number.
This is gonna be really, really
Come here a
good.
lot.
Teresa, thank you for the movie buff stuff. Love that. Okay, this is normal. This normal bunching is perfect, actually. I mean, she's gonna get a really tight, substantial result. Actually, probably better than even Deanna if she's on there listening, because she loves our stuff. She did it on live as well.
She's one of the
Okay,
famous
scissor.
ones we did.
I don't need it, just need
okay.
scissor. Yeah, I'll do it on the other side. So we're gonna lock these, we're gonna cut them out. We're gonna secure them. Here, hold on. I don't wanna get her skin. There we go. That one's a little close. It's okay.
We're just finding out now that we're in New York and we're all over the place. Yes, guys, we're in LA, we're in New York, we're in Florida, we go everywhere.
We're on the road. So you guys will see in a second. I'm gonna lift her once we complete this, so you guys can see we pull her hair. Thank you. So this normal bunching is perfect. It's actually exactly what we want. A little less. All should be done. It's on the other side. Beautiful. Good. Okay, let's turn now to the other
Sorry,
side.
Mom.
Sorry.
Okay, keep
Yeah.
turning.
So we're gonna secure these as well.
So relaxed.
I know, I love that. Isn't that crazy?
Mm-hmm.
So I want afterwards a little love in the lid. I want to get that little
Okay.
piece right there.
How long does it take for the depressions in her face?
Week or a couple weeks. I've seen up to 6 weeks. It's not too bad. She's actually prepared and totally fine.
Can you revise acne scars when you have current acne?
Yes, but we may need to treat you with Accutane. There we go. Securing those cones. Russ always double checks my cutting of the sutures. Sometimes I miss one or two. Every so often, we don't want a little tail
Although we don't do it
on
here.
you for weeks. You see we're securing. Last one. There we go. Perfect. Okay, let me see a straight. Wow, look at that jawline, guys.
Wow.
So just give me a little 11. Okay, so show that it looks straight. So this is actually perfect. You can kind of show them a little bit.
I feel like I can't talk, but I can talk.
You can talk about, yeah, exactly.
I felt
It's tight.
nothing. It's amazing. I'm so happy.
She's all done.
I do have a question though. I don't know
Yes,
if you
tell
do.
me.
So, how do my eyebrows look after that? Don't need a lift on that.
No, I mean, look, I like your brows.
Are you
It's up to
sure?
you. Yeah, I mean, we can always do brows anytime as well. I think your brows look nice. You'll decide when we look.
All right.
I'm just gonna do one little thing that I'm gonna show them. Let me here.
You need me look?
No, you're good. Sometimes at the insertion points. Force it. Hold on a sec. Sometimes at the insertion points, you guys, if the skin is really thin, you could see a cone, and I don't want her to have a cone that's visible for a long time. So make sure that's not. I think we're good. Take a look when she's sitting up. Okay, let's sit her up.
Am I going up?
We're going up, guys.
On my own? Why do I feel like I can't move?
No, you don't move. You're good. We're just gonna raise you.
Someone said, "Love you, Allison."
Who's
Beautiful
that?
inside and out.
Who's that?
We're gonna put it on selfie mode right now.
Yeah.
We'll let you see.
Oh,
No, you don't move too much. Right there is good.
Should we give her the phone?
Give her the phone. Keep your chin up just a little bit.
Alright.
Check everything.
Here you go.
I
Let's see.
still
who's
wanna. I
talking
still
to you.
wanna get that a little bit more. I'm gonna take this off.
Who is it?
good, yeah.
Ah, Sa- Oh
Here,
my
grab the phone.
god.
Grab
Take
the phone.
that. Take the phone.
Grab the phone.
Grab it.
Yeah. Oh, this?
No, grab
this
this.
Oh, I'm sorry.
Just look at yourself.
Holy
And take a look.
shit.
What do you think of the tightening? Look
Oh
at the 45.
my god.
Look at the
Sarah,
angle.
what do you think?
Look at the angle.
Oh my god.
Much tighter. Obviously,
Everything I wanted, honestly.
we're gonna get there. It's gonna be perfect, and it's gonna continue to improve.
Oh my god.
So look, bring it down a little bit, and then look here on the angle. Turn a little bit so you can see. Look at the 45. And then now give her the mirror. Let's
Oh
give her
my
the mirror.
God.
Let her see.
All right.
I just need a light. I'm gonna need like my headlamp, or I just want to do that little spot. Mirror, where is it?
All right, guys. Tighten right.
I felt nothing. It was amazing. Everybody in here was awesome.
We need to give her a mirror. Hold on.
Linda, Sarah, Melissa, you guys watching?
Yes.
Yeah, nearly said nice and tight.
Only the best.
Only the best, you guys. I'm super excited for her. I'm just gonna give her the mirror so she can look, and then you guys we're done. All right. Grab the mirror.
Can I can lift up, right?
Yeah.
Oh yeah.
See how tight it's gonna be here?
Yeah.
This is gonna be improved. All this whitening's the lidocaine is gonna go down, but this is all gonna lift, and I don't think the bunching's bad at all.
No.
It's gonna be super
No.
great.
Do I do
So-
anything about that?
No,
Just let it
just
go.
leave it.
Just leave it.
So this is Mega Lift, you guys. Mega Lift with threads with my lovely lady here. She's super happy. It was great.
Super happy.
And she'll send us some pictures. I know you guys are
Absolutely.
crazy about seeing results, okay? Thanks for Manhattan.
Thank
Bye.
you.
Will you grab me my headlamp a sec?
Yeah.
I just
So
wanna-